Here.
Great.
Boom, just like that.
Okay.
Okay, Keith. So, Keith, what's been going on, man? What's bringing you all the way in? Because you've been a long-time follower, following Dr. Tubio since you even started, right?
Yes.
And then just following along with all the docs in our adventure.
Yes.
So, what's bringing you in from LA?
Okay, so originally this was supposed to be for my brother. Back in July, we were visiting family out of state, and he had been complaining for a while of different back problems, arthritis, and what have you. Unfortunately, he passed away of January of this year.
Wow.
And so we've been wanting to, or he been wanting to do this, try to set it up. I said I would set it up for him, and unfortunately, because he passed, I wanted to, of course, didn't want to miss the opportunity to take this, leap, because I've never done this before. Like I said, I watched all you guys from the very beginning. Pretty much that's why I'm here.
Yeah.
I wanted to get aligned.
You're here for your brother. That's beautiful. And it's like, as soon as you told me that, like, man, my heart sunk. Like, my condolences. It's tough losing your family member, and just you being here for him. That's just it's so beautiful. And we want to take care of you because you deserve to be in this healing space and feel better, because there has been stuff going on with your body too.
Yes.
Right?
Yeah.
How's this all been for you, like this whole process right now?
It's been sometimes a little bit difficult. Sometimes it gets better. And I have my good days and bad days, just like everybody else does. Sometimes I just don't want to leave home. I just want to stay, but I can't. I gotta go out and do something. Otherwise, there's not much else for me to do.
Yeah. You gotta keep busy, right? You gotta keep the memory going too of your brother, because you guys were twins.
Yes.
Yeah. You said fraternal twins, right?
Yes.
And Keith was telling me that his brother was a minute older.
Yes.
Yeah. So he still kind of held that over you, huh? Yeah. So in honor of your brother, right? And what was your brother's name? Kevin, right? So in honor of Kevin, we're gonna get you adjusted and feeling good, because he's watching too. He was very excited to be here, right? He was a longtime follower too.
Yeah, I was in some sort of room, and I happened to hear some sort of voices, and actually it was Dr. Tubio.
Yeah.
And I was like, I did not know that he followed him too.
That's
I was like, what is this strange voice I'm hearing? This sounds so familiar. And lo and behold, it was actually Dr. Tubio.
That's hilarious.
So, we both follow him. I don't know how much more he followed him than I do, but I pretty much on a Saturday morning, when the YouTube video pops up, I automatically watch it when I have the chance.
So you guys are probably watching it at the same time, and you just didn't even know it.
Could be. I don't know.
Oh my gosh. Well, I really wish I could have met Kevin, and I'm very honored that he would trust us with his care, and now you trusting us with your care. Like that means the world to us. So let's start getting you taken care of, because like you said, you've never been adjusted before, right?
No, never.
So let's get you adjusted in the name of Kevin.
Okay.
Right? Let's see. So let's just, because, Keith has a bunch of stuff going on. Primarily, it's been your low back and then a lot of neck stuff, right?
Yes.
So with your low back, even when you were walking in earlier, it was very difficult for you to kind of stand up and move around, right? You feel very unbalanced.
Yes, yeah. If I sit like in a very, very low chair, sometimes I can't really get up. My knees might start bothering me, and I have to, very, very carefully get up. Otherwise, I may fall over and injure myself, and I don't want to do that.
Yeah, that's not good. That is not good. Here, let me have you stand up, Keith. I want you to kind of move around here.
Okay.
So walk back and forth.
Okay.
And you know, it looks like sit to stand motions are a little tough. You do look like you're kind of offset with your walk.
Yeah.
Go ahead and walk around the table here. So when you're walking, what do you feel typically in your body?
I feel a bit of an imbalance. It seems that my left leg may be shorter than my right, because it feels like I'm
like tilting, like teetering over.
Yeah, teetering to the left, yes.
Yeah. Well, let's have you take this stand over here again.
Oh, okay.
Yep, right over here. Yeah. And then I'm just gonna have you reach down. You're gonna touch your toes. I wanna see how your body moves. Okay, and then come back up. How does it feel just with your body like that?
Well, it feels fine. It's just when I was trying to touch my toes, my back of my knees kind of hurt, but nothing in the back.
Nothing in the back. Okay, let me even take a seat in the middle right there again. So the other thing too, Keith, is because of how imbalanced your upper neck is, you know, how straight it is, how forward your neck is, that can also really throw off your gait, right? Because our brain and body's always trying to analyze things that we're seeing, right? That balance, the proprioception is what we call it. So remember, taking a look at your x-rays, we can just see how twisted your head and neck are and how far forward this is. That's why you have this huge hump and flexion. So it's like your body's kind of teetering over, and then you trying to walk on that is pretty rough, right?
Yeah, yes.
So look straight ahead. Let's have you look and turn to the left this way. Okay, so it stops about here. Turn and look to the right this way. How do those two feel? Is one harder than the other?
I know that when I'm looking on both sides, it does kind of hurt, but not so much.
Yeah. Okay. So both are pretty rough.
Yeah.
Look up a little bit higher. I'm gonna have you tilt your head to the right. So we don't get very much tilt.
Yeah.
Tilt to the left. Interesting, your head even likes to turn back to that right side, which is what we're seeing. Your whole jaw likes to really go over to the right. So let's get this side. We're gonna mirror that, right? We're gonna do the opposite. So I'm gonna come over here, scoot forward a little bit more, plant your feet on the ground.
Okay.
And then a little bit more to the left here.
Okay.
There you go. All right, Keith, you ready for your first adjustment?
Yes.
Awesome, let's do it. I want you to relax your shoulders. Great. Look straight ahead. Let's see. So right there, okay? We're gonna take it from the back of your skull here. And give me 1 second as I move stuff around here. Good. I want you to relax this shoulder. Great. Okay. And then we're just gonna. Ooh.
Yeah.
That's already popping.
Yeah.
Look at that, just like a little light contact. So we're gonna keep it there. Your body's telling me that's the spot. And then as we come in, take that nice deep breath. Perfect.
Oh my goodness.
Wow.
Was that better for you than it was for me?
I'm not sure. That was so good. That was very satisfying for me. So how did it feel for you?
Well, me being the first time, I don't know.
What's the first thought that comes to mind with that?
Relief. I just, like I said, I've this. I'm sorry, I'm a loss for words, but I've seen like so many videos, but I've never had it done to myself.
It's so different being on the other side, huh?
Yeah.
It's a relief that I wish so many more people would experience, because I mean, I get adjusted so often and I see all of the people, like just the expression and feeling that we all get from it, and it's just like, it's so beautiful. How's that feeling, man?
Very good.
Feels good? Yeah. That was great. That was clean. Turn and look to the right.
Oh, okay.
Is that it?
Yeah, I feel better, yes.
Oh, all right. Let's go to the left.
Okay.
That's a little easier too?
Yes.
Look at that.
Oh my gosh.
Oh man, okay, well, let's do the other side too, right?
Okay.
Let's see. All right. Yeah, we're gonna do this one right here. So this one's gonna be more of your atlas because it is shifting to that opposite side, right?
Okay.
So very similar, Keith. Good. I got you right there.
Okay.
Relax the shoulder. Yeah, there you go. Perfect. So this one's gonna be a little bit more of like a bend this way, and then a lift up. You feel that?
Yes.
We got him. Oh.
Oh my.
Wow. That was crunchy.
Oh yes. Yeah, I think that the left side was more than the right.
Yep. I heard at least 3 in there. I felt 3. What's going through your mind, Keith?
Just thinking about Kevin right now, and that it took a long time for me to do this.
Yeah.
Originally, when I was going to do this,
Sorry, I got you, Keith.
I'm sorry. Yeah,
no, you don't have to
originally, when I want to do this, I wanted to, go to Houston because that was the place that was out there.
Yeah,
and I'm
yeah.
so glad that you're out here in California that it's much more, well, not local to Los Angeles, but I still could.
But it's a lot closer than Houston.
Yes. Oh, yes.
Man. Keith, what was Kevin like?
He was a very, very nice person. You love him too, just like me.
I love your energy, Art. I love him too.
Yeah. Not only was he, 1 minute older than I am, but
Yeah.
he really liked being, doing things that I like to do.
Yeah.
Tried to, keep busy and that kind of stuff. We have this bond, and we try to, see each other as much as we can. And we, talk on the phone, and then of course when he got sick, I couldn't really visit him as much as I should have.
Yeah.
He gone to many different hospitals and wasn't getting any better.
Wow.
Unfortunately, he had stage 4 cancer, and then of course, the last time I saw him was New Year's Eve.
Yeah.
And then when I got the call that he got passed on New Year's Day, I just. It's still hard.
Yeah. I think it's very honoring to talk about our loved ones even when they're gone. I think that keeps their memory going, right? They live on through us. I think memories are powerful like that. And Kevin sounded like an amazing individual. He was strong.
Yes.
He was passionate.
Yeah.
And I feel that, it's tough.
And you try to be, I tried to be strong for my mom, but then sometimes it's the other way around.
Sometimes we need to get taken care of sometimes, right? Yeah. Those roles really flip, but man, you've been pushing through it. And you being here is like a testament to that. Yeah, Kevin would be proud.
Yeah.
I know he was proud.
And and when I got here, I didn't think I would break down like this.
It's okay, because this is your space. Right, this is your space as much as it is our space. You get to express the way that you want to express, feel the way that you want to feel. And along this adventure that we're doing right now, I'm just pushing you and nudging you in those directions that you need to be. Yeah. Is that feeling good?
Yes. Yeah, very good.
Yeah, good.
Very good.
Ooh, 2 huge adjustments already, man.
Yeah.
This is we spend so much time just in stuck or in go mode, and sometimes we just need to slow down and appreciate those moments, man. Yeah. You ready for some more?
Yes.
Yeah, let's get you adjusted. Yeah. Because we got to get you feeling even better, man.
Yeah.
Okay. It's like I can feel the vibe. It's that energy.
Yeah.
It's that energy. I love it. So let's keep moving you here, right?
Okay.
I want to get you adjusted in that spot that's pretty stuck in your thoracic spine here.
Yes.
I'm going to have you actually face that way towards the wall.
Okay. Oops.
Good. Hold there. So let's get you even more motion here, right? This is going to help work on that posture.
Okay.
And the more that we get you into that alignment, man, you're gonna be feeling even better. Right there. Bring this up. Are you able to hug yourself a little bit more here? Just like that.
Okay.
Good. So I'm gonna bring you down here.
Okay.
Good, I got you. Gotta do this little dance as we come down. Good. And right about your T5, T4 area. Now breathe, Keith, and then let that relax. I got you.
Oh, my
Wow.
goodness.
Oh, man.
Oh, wow.
That was good too.
Yeah, I have to thank Dr. Pinto for that block.
Yep. He really coined this block. It's a deep one. Thank you, Dr. Pinto.
Thank you, Dr. Pinto.
That's awesome, and it's beautiful because you have all of us here, and each one of us kind of brings a slightly different flavor, but we're all trying to do the same thing.
Yes.
Which is great. How'd that one feel?
Oh, very good.
Yeah?
Very good, yeah.
Sweet.
Yeah.
Okay, so that's great movement there.
Okay.
Keith, let's have you go face down.
Okay.
Let's start to work on this other stuff here. Okay. Let's see. All right. How's it feel just laying down? Is it easier? Is it smooth?
Yeah, very, very smooth.
Good. I'm gonna pull you down here.
Okay.
All right, let's test out this low back. Let's see, let's get you better mobility here. So with a straight leg, lift this leg up as high as you can go. So try not to bend the knee and then lift up. So very little.
Oh, yeah.
Yeah, it's a little rough. How about this one? Oof, okay.
Yeah, that's...
Maybe like a tiny bit better, but
like I was saying, my left was better than my right.
yeah. Those are both rough, so we're gonna do a couple things here, okay? And let's see. Keith, I gotta say, you got some big shoes.
You know, yeah, I'm size 15, so
Damn.
yeah. I know. I was doing a notary job one day, and so the person said to take your shoes off. So compared to people that have smaller size shoes than I do,
Yeah,
he was surprised to see you are.
yeah, you're you're way bigger. You should talk to our other videographer, Eddie. He's like a 13.
Oh, okay.
Yeah, you guys would be best friends.
Oh, yes. Oh, yeah.
All right, hold on to the handlebars up there,
Okay.
Keith.
Yes.
And I'm just gonna get some space in between your hip and ankle.
Okay.
This is gonna help you get better motion in the extension. So, yeah, feel that little traction there?
Yes.
Good. Good. Do you feel that go up to your hip?
Yes.
Great.
Yes, I did.
All right, I'm gonna do another one here. There you go.
Oh my goodness.
So your right leg is shorter.
Oh, okay.
Yeah. It's not like physically shorter, but because your hips are misaligned, it's pulling that femur up.
I got you. Okay.
And then as we bend it, it actually lengthens. So that's just telling me that you have some fixation of this hip.
Oh.
Yeah, and it feels a little stiff in there, huh?
Okay.
So this is gonna lift up. It's gonna get a little loud.
Okay, no problem.
And then we're gonna push it down. So this is a drop table, Keith. It's just another way to adjust you.
Sure.
Good, so I'm gonna focus on that hip.
Okay.
Good. Not too bad, right?
No, not at all.
Couple more. Try that right leg again. Oh, okay.
Oh, okay.
Yeah.
And I feel the bone pop.
You feel a little pop there too, right?
Yes,
Yeah,
yes.
I heard it. Good. A little bit better motion. We're gonna go to your lumbar here. Give it a little push. Oh, it's a little too light. Good, 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 good. Good. And then right in sacral base, right there. You feel that?
Yes.
So we kind of do like a little pump
Okay.
and then a little bit deeper. Okay, try the left leg now.
Okay. Oh,
Ooh.
yes.
Yeah, okay.
Yeah, I can't see it, but I can feel it.
You can feel it.
Yeah.
Don't worry, we can see it.
Okay.
So try the right one again. Woo, look at that.
Yes.
Let's go. Great. All right, we're gonna do this hip, turn face that way.
Okay. This way?
Yep,
Okay.
on your side. Sorry, you can, turn completely. Get your arm in here too. I gotcha. All right. Scoot down this way. Tip forward. Almost. A little bit more. Yeah. Okay.
Okay.
All right. Hold there. We're gonna move you a little bit. Scoot this forward. There you go. Perfect. All right, Keith. You just stay chill right there.
Okay.
Okay. Hold that. Let's see. There we go. Okay. Let's do. So those lower lumbars,
Yes.
they're gonna be a little bit more stuck because you do have that fusion.
Okay.
So we just need to target a little bit higher and just get as much motion in here.
Okay.
So with this one, relax your belly. You're gonna roll like a little roly-poly, and then I'm just gonna give you a nice drop here. Super smooth, super nice. Great. You're not gonna fall, promise.
Okay, yeah.
I got you.
Yeah.
It's like a trust fall. There we go. How's that?
Oh, very good.
Yeah?
Yeah.
Go to the other side, the flip over.
Make sure I have to close my eyes, not see it. Thank you, Dr. Tubio.
Yeah. If you close your eyes, it makes it easier.
Yeah.
Good. Okay, bring this one over.
Okay.
Yeah, there you go. Hold here, head back. Great. This leg down. This leg up. So this side's a little tighter, a little wonkier.
Okay.
Is it because it's pushing out?
Yeah, but it turned off. Yeah, it's off. Okay. For this one, bring your hand up.
Oh.
Yeah, just like that.
Okay.
All different ways that we can get you adjusted.
Yes.
Good. Perfect. All right, roll with me.
Okay.
Good. Perfect. Go with me a little bit further.
Oh.
Wow.
Oh my. Oh.
I think that one was better.
Okay.
How'd that feel?
Oh, very good.
Very good?
Yeah.
All right, Keith, have you go face up on your back.
Okay.
How's it feel just laying there?
Oh, very good.
Very good?
Very good, yes.
Here's a tissue if you need a little bit more.
Okay then. Oh, yeah.
Yeah, there you go.
Oh, I do feel a mess.
It's okay. We're all a little bit of a mess sometimes.
All right.
All right, you ready for some more?
Yes.
So what we're gonna do is, we're gonna open you up. We're gonna get you a nice pull here.
Okay.
Decompress you, but I need to fix you because you're a little tall, Keith.
Oh, yes. Yeah.
Good. Actually, do you mind passing me that, please? Thank you. All right, Keith, I'm sure you've watched this one a couple times.
Yes.
Head down. And let me hold this for me real quick.
Okay.
Lift your head up again. And head down. Hold that. All right. Almost. All right, now pull. Just kidding, don't do it.
I wouldn't be able to do whatever.
No, yeah. Not recommended.
No.
All right, Keith, we're gonna decompress you because you've spent too many years just pressured by life. How long would you say you've been dealing with all of this in total?
Oh gosh, it's not exactly sure, but it has been a while.
Yeah, years?
Yes.
Yeah. Way too long, man, especially with your curves and how they are. This has been something that's been there for a while, right? You just don't necessarily feel it right away because pain is never the best indicator. Pain will be like the last thing to show up and the first thing to go away if you just take some pills or mask it. But
yeah, I'm not into that stuff.
yeah, no, right? You want to do it more holistically.
Right.
Keith, man. Keith's the MVP here, man. All right, you ready for this?
Oh, yes.
Good. I'm gonna give you a nice traction here just to open up those joints.
Okay.
Good. Take some nice deep breaths. You're gonna feel this wave, Keith. Just think of an ocean wave. Just perfect. I like that, Keith.
Oh, wow. Ooh. Oh gosh. Now I have to apologize to all the other people I saw on YouTube.
You don't have to apologize.
I'm just kidding. I'm just kidding. Oh well. Oh, and yeah. Like I said, I've seen so many of these YouTube videos, but never had it done to myself.
Man, I mean, after experiencing that so many times, watching it, and you being right here, man, what does that do for you?
It's after all this, I feel so much better. I got to meet you and Ken, and I can go on Instagram and see the other people too. Yeah.
We're here for you, Keith, man. Yeah. I'm very happy that you came in today.
I am too. I really am. Like I said, it's taken a while for me to take that leap of faith. After my brother's passing, like I said, I didn't want to pass up this opportunity to go and see this now that you are here in California? I don't want to drive or fly out to Texas.
Yeah, no, you don't have to go as far. We're right down the street. Not really down the street, but
Yeah.
but a little bit. Let me have you come up.
Okay.
Take it slow. Take it slow. Yeah, how's that feel?
Very good.
Good?
Yeah.
You know what, let's finish up a little bit more with your feet.
Okay.
Because you are having that wobbliness and stability.
Yeah.
It is part of your gait, and I like adjusting feet as well. So
Sure.
actually, come back.
Oh.
Come back. Yeah.
Oh, okay.
You hold there.
Sure.
So before we finish you up, is it okay if I take these off?
Absolutely.
All right. Just try.
No, I wasn't kidding when I had big feet.
Yeah. You have a strong foundation.
Yes.
So we got to keep it that way.
Absolutely.
Yes, sir. Let me grab my tool that I always seem to lose. Okay, I found it. Okay. Let's see. So talus, the top here, can either slide forward, back, side to side. So we need to get in here and kind of push it down back.
Okay.
Does that feel okay?
Yes.
Good. Yeah, and your feet don't really bend, so we're gonna go right in here.
Okay.
Okay, you're gonna feel a nice pull here.
Okay.
Boom.
Oh.
How'd that feel? That's good, huh?
Yeah.
All right, bend this.
Okay.
This is gonna be like the cherry on top,
Oh, okay.
so we can get you moving better.
Oh, yeah.
Good.
Yes.
Let's do the other foot.
Okay.
Yeah. And right there.
Oh.
There we go. Also a good one.
Oh, okay.
Then this.
Yeah.
Great.
Oh.
Oh, there it is.
Okay.
Yeah.
Okay.
You felt that?
I didn't feel it, but I took a word for it.
Yeah. So let's get you standing up. I want to see how that moves.
Okay.
All right, Keith. Let me have you walk around a bit.
Okay. Yeah, it feels much better. I'm able to, not walk as a, like I'm going to the left or the right hand
Yeah,
side.
I mean, your walk is looking smoother. Let me have you stand right there.
Okay.
And I'm gonna have you reach down and touch your toes. Come back
A little
up.
bit better, yes.
Feels a little bit smoother.
Yes.
Let's have you go face down again, just so I can test that motion. Good, right there. All right. Look at that, brand new Keith.
Yes.
Lift up these, good. Okay, let me have you lift your right leg as high as you can go. Good. How about the left one? Look at that.
Amazing.
How's that feel?
Absolutely amazing.
Feel smoother in there?
Yes.
Heck yeah. Let me have you sit up. You're gonna face Ken again.
Okay.
Good, and then look to the left. Yeah. What's up? Look to the right. Smoother, easier.
Yes.
How's that feeling overall, Keith?
Oh, very, very, very good. Very good. it feels so much better from before to after.
That's so good. It's been a long time coming for your body, right? And we want to keep taking care of it. All these types of adjustments are going to be something that's going to keep you on that path to a healthier lifestyle. Of course, I'm going to give you some good recommendations, things to do for your body, tools to help maintain this. But I mean, overall, with everything that's been happening, because I know how difficult it is to lose somebody like that, especially somebody that close, and especially during that time of the year, right? It's a lot, like even just the emotional stressors. How are you feeling right now, man?
I'm doing very well.
Yeah.
Like I was mentioning before, I do have my good days and bad days, and then sometimes I just don't want to show it.
Yeah.
I'd rather,
Yeah.
say that everything is fine when it's not, and I just want to be by myself and cry my eyes out, which is,
Yeah. Well, at least now you can have us here to be a tool or somebody that we can just, provide a healing space for you during this time, because we love you, man. We want to keep you feeling good. Yeah? How you feeling? Feeling overall?
It's been a wonderful experience. It's been a pleasure.
The pleasure's all mine, Keith. Man, you did so great. Let's yeah, of course.
Thanks so much.
Can I give you a hug, Keith?
Absolutely.
Yeah.
Thank you.
Yeah.
Thank you so much.
You're so welcome. Yeah, we appreciate you. Let's keep you feeling this way, okay?
Yeah.
You ready? Cool. Yeah, let's go.
Thanks so much.
So let's go over a couple things.